I built many patient tools, sites, and apps trying to support patient prior and during treatment. I think one of the main barrier obviously is tracking, right? I mean, what's the incentive to actually entering things into a device to track your symptoms? That's, difficult. That's why, IoTs, wearables, or any other ways to, provide that information is very, very appealing. Or even voice. I really believe, not for ALS, unfortunately, because most patients can speak after a few years, but for most diseases, voice is a great way to just, interact. Or, chatbot or new AI, powered conversation that kind of simplify, the engagement. Because I do think that's like one of the primary challenges, like, getting the patient to keep using the app and keeping, entering data. That's been the first, I would say, the primary one. Also, I think sometimes patient engagement is too focused on the patient, and we're not looking at the caregiver. And in so many diseases, the caregiver plays such a critical role. So we have to think about engaging the caregiver as well, and more importantly, enabling that kind of like network of supporters, of the patient, the friends, the families, the neighbors that can really support the patient through that journey, and enabling, this support. I mean, Facebook is great because you can hear from people that you haven't seen in years, but it's just about, there's really no, it's not centered around patient, right? But if you think about how we can enable that core, group of people that are so important in the life of the patient, or amplify what they're already doing, could be actually very meaningful.
Yeah, and I agree around the patient engagement and getting them to enter the data. But what we've done is we've developed a web-based platform in which they're able to enter information. But it's not just you push out a survey. What we try to do is, we call it a patient engagement system, where they're building their own electronic health record, right? So they're getting something back,
yes.
And they see it. And I think that is one of the things I think that's missing, right? That you want to know that your data is going somewhere and that you can use it, right? With not only your, say for me, like my MS neurologist, but also with other healthcare providers. And we're capturing not just patient-reported outcomes, but healthcare resource use, right? And then we don't stop to just say, did you go to the ER? We ask, well, did you go to the ER? Was it MS related? And did you go to the hospital, right? What was the reason? So that you're collecting additional information that, again, helps healthcare providers better understand, right, what has happened, but also the patient also sees, right, because we've built a timeline to say, like, when an MRI was done, if they went to an ER, or if they went to hospital, and how long they stayed.
But do they own that data, though? Can they really, keep the data and say, okay, I'm going to share it with you, doctor,
absolutely.
or with someone else?
It's
so it's really like building your own health record, right?
Absolutely, that they can share, again, not just with their MS neurologist, but other primary care physician, other specialists, and that's how you start to also address the healthcare cost, right? That you, by sharing this information, especially with healthcare resource use, whether it's MRIs or labs, diagnostics, that you don't then, right, it creates a way to drive efficiency in healthcare so that you're not duplicating those same services. We also capture, other allied health professionals. So are they using PT, OT, social work, right? So that's all included in there. And that, again, any of those healthcare providers is able to see, how these patients are doing longitudinally, right? And then on the back end, we have reports for when they do see their MS neurologist and all the different data points and how they're doing longitudinally.
And the physician has also a report, or is it just
the MS neurologist does.
Will have access to that information as well.
And again, over time.
That's awesome.
Right.
And people are using it. What
absolutely.
Type of usage you see? I mean, in terms of, like, is it 50% of the patient using it, or 100%, 10%?
So we enrolled in one of our studies. It was 520 patients, and we have about 350 that are still active users.
Wow.
Over a year time frame.
How often? Like every month, every week?
So what we've done is what we've learned is that you have to engage patients at least once a month. Right. Weekly's too much. Every 3 or 6 months is too long. So we try to do it every month that we're rolling out a set of surveys, but we also let them journal. And then they get to, decide what is important to them that they want to track, whether it's fatigue, whether it's exercise, diet, that they get to personalize that, and it gets logged right in their calendar.
And the incentive is just having access to the data, right? There's no additional incentive.
Absolutely.
Yeah.
And then again, they're able to see themselves, save their tracking fatigue or their mood, how they're doing.
Yeah, patient like me kind of model, right?
Absolutely.
Yeah.
I think I'd like to say a little better than patients like me, because I think we're capturing more. Right? It's a more holistic view.
And does it take too much time? I mean, for the patient to enter all this data?
No, I think on a monthly basis we try to limit it to about 15 minutes. Right, but they can engage as much as they want, as little or as much as they want. They can go in daily if they want, right, to track their symptoms. So I think that is the way of the future.
It is.
But I do think, like you said,
and it's just a website, or is it?
It's a website. It's web-based. So it's device agnostic, right? So then you can reach more patients. But I do, I think the engagement piece is the hard piece. How do you keep them interested in wanting to go back and enter the information?
Yeah. And what could be the incentive to do that?
Yes.
Yeah.